Pregnancy and dental work questions are common for expecting moms. Preventative dental cleanings and annual exams during pregnancy are not only safe, but they're actually recommended. Dr. Kristin Swanson from AOMS Pediatric Dentistry joins us today with more. All right, so moms out there who are pregnant, future moms, they're saying, I'm pregnant, is it safe for me to go to the dentist? And do I still need to go to the dentist during this time?
Absolutely. When you're pregnant, there's so much going on. There's so much that you're dealing with, and sometimes your dental health and your oral hygiene tends to go on the back burner a bit, especially when you're brushing your teeth, and the mere thought of it is just making you nauseous.
Sure.
But ideally, there's so many things that are more common when you're pregnant when it comes to your dental health. For example, gingivitis, you might notice your hormones are rushing and your gums feel a little more swollen or more prone to bleeding. Caries or cavities are more common. Your diet tends to change when you're pregnant. You might snack more or get sweet cravings.
Sure.
So that's one thing we really need to stay on top of. And then finally, morning sickness. That creates a lot of acid in your mouth, which can break down your teeth. And all these things combined cause you to need to go to the dentist, not more often, but regularly.
So when should you, when you're pregnant, what's the first time and what's the safest time?
So dentistry is safe. Most procedures are safe throughout the entire pregnancy. However, during the first trimester, it tends to be a higher risk. Yeah. So we usually avoid that time frame. And then during the third trimester, you can be relatively uncomfortable in the chair, laying back, staying in the chair for longer periods of time. So we traditionally recommend coming in during your second trimester.
Second trimester. Now let's say something crazy happens, you have some sort of oral emergency. It is safe though to get that taken care of during any point in the pregnancy.
Absolutely, absolutely. In fact, the American Dental Association, as well as the American Congress of OBGYNs, recommend that emergency treatments such as root canals, extractions, or even fillings, it's better to get on top of it sooner rather than later, because if you prolong this treatment, then it could have more complex problems in the future.
Absolutely. So the summary is, gotta go to the dentist all the time, even when you're pregnant, and it's totally safe to do.
Yes, definitely. I would recommend brushing for 2 minutes twice a day. Use a soft bristled toothbrush. Using fluoride-containing toothpaste is critical. And then also flossing or using water picks or floss picks for in between your teeth at least once a day.
All right, good advice. And congratulations to you. You've got a couple more months of that baby cooking, but in March, right?
Yes.
Oh, well, wonderful, 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 and a very timely topic for you as well.
Yes, absolutely.
Thanks for coming in. If you have any questions, give our friends at AOMS Pediatric Dentistry a shout. Coming up next, we're going to head into the kitchen with Chef Bud for Cajun shrimp